Good afternoon. I'd like to call this meeting to order. Today is Tuesday, March 25th, 2025. The time is 2:06 p.m. This is an additional meeting of the Committee on Health, and we are holding this meeting in a hybrid format in room 123 of the John A. Wilson Building. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. We've been joined by members of the committee, Councilmember Charles Allen from Ward 6, Councilmember Zachary Parker from Ward 5, and Councilmember Brianna Doe from Ward 1 is joining us online. Today, we will consider and vote on 8 measures. We have 3 reappointments to the Food Policy Council, as well as 5 appointments to the Board of Integrative Healthcare, which is a new board created by the Health Occupation Revision General Amendment Act of 2024. Also, just a small complication, we will soon rename this board to the Board of Acupuncture, Chiropractic, and Neuropathic Physicians. If there's no objection, I will move the Food Policy Council nominations in block. Okay. The Food Policy Council is tasked with promoting food access sustainability in the local food economy in the District of Columbia. The FPC advises the Food Policy Director and submits an annual comprehensive report to the Mayor and the Council of the District of Columbia outlining the state of the local food economy, suggesting policy revisions, and identifying funding priorities. The FPC may also seek grants and funding to bolster its efforts towards enhancing food policy and equity in the district. PR 25 PR 20 no PR 26-58 nominates Nicholas Stavely for reappointment as a public member to the Food Policy Council for a term to end March 1st, 2028. Mr. Stavely is currently the Director of Incentive Programs at Fresh Farm, where he provides strategic direction and leadership for the local and regional healthy food incentive programs. He leads the program fundraising efforts to ensure continuity and growth of food access services for thousands of residents and local farmers. Additionally, he implements all aspects of the Fresh Farm food access programs, including Produce Plus, and the organization's portfolio of independently funded benefit incentive programs. Mr. Stabley holds a Bachelor's of Science degree in Agriculture and Resource Economics from the University of Maryland, College Park, and he is a Ward 1 resident. PR 26-59 nominates Rachel Clark for reappointment as a public member to the Food Policy Council for a term to end March 1st, 2028. Ms. Clark serves as the Director of Policy and Engagement at the Climate and Health Institute, where she focuses on the intersection of climate change, human health equity. Previously, she worked on district food, nutrition, and environmental policy as the policy director for the GW Redstone Global Center for Prevention and Wellness. In her first term on the Food Policy Council, Ms. Clark chaired the Sustainable Supply Chain Working Group, which developed recommendations for legislation to support farmers markets, and as well as develop recommendations to improve food procurement purchasing in the district. Ms. Clark received her Juris Doctorate degree from Harvard Law School, and she is a Ward 5 resident. PR 26-60 nominates Natalia Kalu for reappointment as a public member to the Food Policy Council for a term to end March 1st, 2028. Ms. Kalu is the founder and owner of Kalu Organics, a local seasoning and spices producer, as well as Trini Vibes, a Caribbean restaurant and food truck. Through her businesses, she has gained firsthand experience navigating district policies and regulations for local food businesses. Previously, she served as the Chief Operating Officer for the DC Office of Administrative Hearings. During her first term on the Food Policy Council, Ms. Kalu served on the Entrepreneurship and Food Jobs Working Group and focused on recommendations to streamline the licensing and permitting process for small food businesses. Ms. Kalu earned her Master's of Business Administration from Florida International University, and she is a Ward 4 resident. I'll now open up the floor for conversation on these nominees. Councilmember Parker.
Thank you. I just wanted to again tout the Food Policy Council. It is a body that I don't think gets nearly enough attention, but it is really important, and we have some truly dynamic residents doing amazing work. I serve with the Council of Governments on the Farm Committee, and the Food Policy Council as a constant resource for the district, but in our entire region. I'm hopeful as we are continuing to think as a city about food access in different parts of the district, that we can lean on the expertise more of the Food Policy Council, because I think they have some really innovative thoughts and approaches to how we might get beyond, I think, our economic development strategy that relies solely, it seems, on big box grocery stores. But these nominations I'm really excited about and look forward to working with them and advancing more equitable food policies in the district. Thank you.
Thank you, Councilmember Parker. Any other comments? All right, hearing none, I now move the draft reports and prints for PR 26-58, PR 26-59, and PR 26-60 on block, with staff to leave, with leave for staff to make technical changes. All in favor, please say aye. Aye.
Aye.
Great. Let the record reflect that the ayes have it, and these measures pass unanimously. Okay, we are going to move on to the Board of Integrative Care, and if without objection, I'll move these in block as well. All right. So the HORA created the Board of Integrative Healthcare to increase representation and enhance collaboration for the professions under its purview: acupuncturists, chiropractors, neuropathic physicians. Recently, in response to feedback from the provider community, the committee amended the name of the board to the Board of Acupuncture, Chiropractic, and Naturopathic Physicians. This change will be before the council on second reading at our legislative meeting next week. So I'm going to refer to the board by its current name for the time being. The board will begin to meet once a majority of the seats are filled, or by July 2025, whichever comes first. PR 26-110 nominates Dr. Keita Vanderpool for appointment as a doctor of chiropractic to the Board of Integrative Healthcare for a term of 3 years. Dr. Vanderpool is a licensed doctor of chiropractic with more than 25 years of experience providing chiropractic services to patients in Atlanta, Maryland, and the district. Dr. Vanderpool has owned and operated her private practice for 25 years in the district, and she holds a doctorate from Life University and is a Ward 8 resident. PR 26-111 nominates Dr. Nancy Abaluma for appointment as a naturopathic physician to the Board of Integrative Healthcare for a term of 3 years. In her group practice, she provides patient care and manages chronic and acute medical conditions. She also serves as a partner physician at the George Washington University Center of Integrative Medicine. She holds a Master's of Science in Human Nutrition and a doctorate in Neuropathic Medicine from the University of Bridgeport, and she is a Ward 3 resident. PR 26-112 nominates Dr. Stephanie Johnson for appointment as a doctor of chiropractic to the Board of Integrative Healthcare. Dr. Johnson owns and operates her private practice and specializes in chiropractic care for expecting mothers. Additionally, she is an active member of the American Chiropractic Association. She earned her doctorate from Palmer College of Chiropractic, and she's a Ward 6 resident. PR 26-111 nominates Dr. Gavin Elliott for appointment as an acupuncturist licensed in the district for a term of 1 year. As a board certified medical acupuncturist and fellow of the American Academy of Medical Acupuncture, Dr. Elliott has trained physicians through the Helms Medical Institute and Acuse Foundation. Dr. Elliott is also a board certified anesthesiologist, integrative medicine practitioner, and educator. He has participated in global health initiatives, volunteering and medical missions across India, Paraguay, Ecuador, and Haiti. Dr. Elliott earned his Doctor of Medicine from the University of North Carolina, Chapel Hill, and completed his comprehensive training course on acupuncture at UC Irvine. He is a Ward 4 resident. And finally, PR 26-114 nominates Terrence Hunter for an appointment as a consumer member of the Board of Integrative Healthcare for a term of 2 years. Mr. Hunter is a dedicated Washingtonian with a passion of community service. He's a licensed real estate agent working both in DC and Maryland and helps residents purchase homes. Beyond the professional work, Mr. Hunter actively gives back to the community, volunteering at local shelters to distribute food and clothing and gifts. He was previously served as an advisory neighborhood commissioner for 7FO2 and is a Ward 7 resident. I'll now open up the floor for discussion on these nominees. Okay, hearing none, I move the draft reports and prints for PR 26-110, 111, 112, 114, and 116 in block with leave for staff to make any technical changes. All in favor, please say aye.
Aye.
Great. Please let the record reflect that the ayes have it unanimously. This is my opportunity to provide my PSA. I want to express my thanks to the various individuals who have once again volunteered their time to serve their neighbors as well as their fellow professionals on these boards and commissions. This is for anybody who is interested. Serving on a mayoral board or commission is an excellent way to give back as well as to grow within your profession. If you're interested, please visit the Mayor's Office of Talent and Appointments to see what might be available. This concludes today's meeting. The next meeting of the committee will be tomorrow, Wednesday, March 26th. We will hold a joint roundtable with the Committee on Executive Administration and Labor on strategies to support the district's long-term care workforce. Now, with no further business before the committee, the time is 2:16 p.m. and this meeting is adjourned. Thank you to my colleagues.